So the process of IVF or in vitro fertilization or test tube baby can be split into 5 different stages. So in patient preparation, what is actually done is that the doctor gives a thorough evaluation of the couple's history, orders necessary investigation, which would also include hormonal evaluation to see what the ovarian reserve is or the egg count is. Accordingly, the doctor might suggest certain supplements to try and help improve the egg count or reserve. Then next comes ovarian stimulation. It would mean giving hormonal injections for a duration of roughly about 10 to 12 days on a daily basis. In a natural cycle, every woman develops an egg, the egg matures and ruptures. But in IVF, we want to optimize the treatment, and the intention is to get as many eggs as possible. Now, how do we know if the eggs are growing or no? That is done by serial ultrasound scan assessment by transvaginal ultrasound. So the frequency of scans can be alternate days or once in 3 days. At the end of 12 days, a final trigger shot is given to bring about the maturation of the eggs. Then we go on to the most crucial step of IVF, which is egg retrieval. Egg retrieval procedure is precisely timed roughly about 34 to 36 hours after the trigger shot. Egg retrieval procedure is a minimally invasive procedure and would involve giving anesthesia. The procedure would roughly last for about half an hour to 45 minutes. And in this, we retrieve all the eggs from both the ovaries. After the process of retrieving the eggs are usually cultured for a certain amount of time in a petri dish containing a special medium. So next comes the process of fertilization. During fertilization, the eggs which have been retrieved are usually seen for the status of its maturity as well as its quality. Good quality eggs which are mature are taken and fertilized by sperms. Roughly around 80 to 90% of eggs are assumed to get fertilized. So the day subsequent to the egg retrieval, the embryologist assesses the status of fertilization. The fertilized embryos are further kept for culture in the laboratory for a period of about 3 to 5 days. Embryo transfer is a simple procedure that takes only about 5 to 10 minutes. Embryo transfer is usually performed 3 to 5 days after egg retrieval. The number of embryos which are usually transferred would depend on the quality of the embryos and the decision made by the doctor.